There's a smell I can't escape. Ether mixed with cold air, blood freezing on snow, gangrene masked by winter. 12 years later, whenever it snows, I smell it again. That particular combination of medical chemicals and Belgian winter and boys dying faster than I could save them. The Battle of the Bulge. That's what they call it now. Clean name for a nightmare that lasted 6 weeks in the coldest winter Europe had seen in decades. My name is Thomas Bradley, and I'm 37 years old. During the war, I was a combat medic with the 101st Airborne Division, attached to various units during the fighting in Belgium. December 1944 through January 1945. The worst winter of my life, and I've spent 12 years trying to forget it. Doesn't work. Some things you can't forget, no matter how hard you try. I grew up in Minneapolis, so I knew cold. My father was a doctor, ran a small practice in a working-class neighborhood. I'd spent my childhood watching him work, learning basic first aid, thinking maybe I'd follow in his footsteps. When the war started, I was 21, in my second year of pre-med. The draft was coming, so I enlisted. Figured if I had to go to war, better to save lives than take them. The Army trained me as a medic. 12 weeks of intensive instruction, anatomy, emergency treatment, battlefield medicine, how to keep men alive long enough to reach a surgeon. They taught us how to stop bleeding, treat shock, administer morphine, stabilize fractures. Made it seem straightforward, clinical. Like battlefield medicine was just regular medicine done faster. They didn't teach us what to do when the temperature drops below zero, when plasma freezes in the bottles, when morphine won't flow through syringes, when frostbite kills as many men as bullets, when you have to choose between boys who are all dying, all screaming, all depending on you to save them. You learn that part on the job. I went through jump school, earned my wings, got assigned to the 101. We jumped into Normandy in June of '44, fought through France and Holland. I'd seen combat, seen casualties, thought I understood what war was, thought I knew what it meant to be a medic under fire. Then December came, and Germany launched their last major offensive through the Ardennes forest. Caught us completely by surprise, surrounded the 101st at Bastogne, and the temperature dropped to the coldest winter in living memory. That's when I learned what hell really was. Not fire and heat like the Bible says. Ice and cold and boys freezing to death in foxholes while you tried to stop them bleeding out. December 19th, 1944. We got orders to move to Belgium, reinforced units being overrun by the German offensive. They trucked us in, no time to prepare for winter combat. Most of us were still in regular uniforms. Not enough winter gear, not enough cold weather equipment, not enough anything. The temperature was already below freezing when we arrived. Within days, it would drop to near zero, sometimes below, and it snowed. God, how it snowed. Inches every day, drifts 3 feet deep, everything white and frozen and hostile. I was assigned to a rifle company, roughly 160 men. My job was simple. Keep them alive. When they got hit, I'd run to them, treat them, get them evacuated. I had a medical bag with bandages, morphine, plasma, sulfur powder, the tools of my trade. In normal conditions, I could save maybe 80% of the wounded if I reached them fast enough. These weren't normal conditions. The first casualty I treated in the Bulge was Private Danny Sullivan from Boston. Took shrapnel from an artillery burst, wounds to his leg and abdomen. Standard trauma, survivable. I got to him fast, applied pressure to the bleeding, started to set up plasma. The plasma was frozen solid. The bottles had iced over in the cold. I tried warming them against my body, but that took too long. Danny was going into shock, needed the fluids now. I gave him morphine for the pain, had to warm the syringe in my mouth before it would flow, and did what I could with pressure bandages. He died waiting for the plasma to thaw. Bled out in the snow because the cold made my supplies useless. First day, first casualty, first lesson, Winter kills as efficiently as bullets. The Germans hit our positions constantly. Artillery, probing attacks, full assaults. The casualties came in waves. Boys with gunshot wounds, shrapnel injuries, blast trauma, and frostbite. So much frostbite. Feet frozen in boots, hands frozen to weapons, faces with blackened skin that meant tissue death. I worked around the clock, treating wounded in foxholes, in destroyed buildings, in the open snow under fire. My hands stayed numb, fingers so cold I could barely feel what I was doing. You couldn't wear heavy gloves, needed dexterity to treat wounds, so you worked with bare hands or thin gloves and accepted that your fingers would freeze. Corporal Mike Rodriguez got hit on December 21st. Machine gun fire, 3 rounds through the chest. I reached him in maybe 30 seconds. He was still conscious, coughing blood, eyes wide with terror. "Am I going to die?" he asked. "Standard wound, standard treatment. Stop the bleeding, seal the chest wounds, treat for shock, evacuate." I'd done it dozens of times, but my hands were shaking from the cold. The bandages were stiff and hard to apply, and the blood was freezing as fast as it came out. Left dark red ice on the snow. I got him stabilized, called for stretcher bearers. They took 40 minutes to reach us. The snow was too deep, movement too slow. By the time they arrived, Mike had died from shock and hypothermia. The wounds hadn't killed him. The cold had. That night I sat in a frozen foxhole and counted my supplies. Half my morphine was frozen. Most of my plasma was useless. Bandages were getting wet and freezing stiff. I was running out of sulfur powder, and the casualties kept coming. "Doc," someone called me. They all called me Doc, even though I wasn't a doctor. Just a kid with 12 weeks of training trying to stop boys from dying in the snow. By December 22nd, we were completely surrounded in Bastogne. Germans on all sides, supply lines cut, no reinforcements coming. The siege had begun, and the wounded started piling up faster than we could treat them. They'd set up an aid station in a church basement. Stone walls, some heat from a wood stove, space for maybe 30 casualties. Within a day, we had 60. Within 2 days, 100. Boys lying on the stone floor, covered with whatever blankets we could find, waiting for treatment that we couldn't provide fast enough. I worked in that basement for 6 straight days, treating wounds, changing bandages, administering what little morphine we had left. The conditions were medieval. No proper surgical equipment, minimal light, barely enough heat to keep the wounded from freezing. And the smell. Ether and gangrene and unwashed bodies and death. All of it trapped in that basement, mixing with the wood smoke and the smell of snow that came in whenever the door opened. The frostbite cases were the worst. Boys with feet so frozen the tissue was black and dead. We knew they'd lose the limbs, but we couldn't evacuate them for amputation. Just had to keep them alive, manage the pain, prevent infection from the dead tissue rotting while still attached. Private James Walker from Ohio, 19 years old, both feet frozen solid. The tissue was dying, turning gangrenous. We had no way to amputate in that basement, no way to evacuate him through German lines. Just had to watch the gangrene spread while he screamed from the pain. "Please," he begged me, "cut them off. I can't take it anymore." "I can't," I said. "We don't have the equipment. When we get evacuated, the surgeons will take care of you. I'll be dead by then." He was right. The gangrene reached his legs. He died on December 27th, poisoned by his own rotting tissue because we couldn't evacuate him in time. The surgeons in the aid station worked miracles. 2 doctors and 3 nurses operating around the clock, doing amputations and emergency surgeries in conditions that would have been unacceptable in peacetime. They saved hundreds of boys, lost hundreds more. I watched a surgeon amputate a leg with a hand saw because our medical saws had been lost in the retreat. Watched him work by candlelight when the generator failed. Watched him break down crying after losing his 6th patient in an hour, then pull himself together and move to the next one. Captain Elizabeth Morrison, one of the nurses, worked 36 hours straight treating wounded, just kept going until she collapsed from exhaustion. When she woke up 4 hours later, she went right back to work. No complaints, no breaks, just duty. I tried to be like them, tried to maintain that professional competence, that clinical detachment. But it was hard when you knew the boys you were treating, when you'd shared foxholes with them, eaten with them, joked with them. When you had to tell Private Rodriguez's best friend that Mike was dead. When you had to watch boys you'd kept alive for days die anyway because we couldn't evacuate them fast enough. December 26th, we were running out of everything. Morphine almost gone, plasma depleted, bandages being reused after washing in melted snow, ether supply critically low, and the wounded kept coming. That's when I learned about triage in its cruelest form. They brought in 12 casualties from a German artillery barrage. All serious wounds, all needing immediate treatment. But we had 3 doctors and me in the aid station, already working on other patients. We couldn't treat 12 more. Captain Morrison made the call. She walked through the new arrivals, assessing wounds, making decisions. Black mark for those too far gone to save. Red for those who needed immediate surgery. Yellow for those who could wait. She marked 4 of them black. I watched those 4 boys die over the next hour. Watched them bleed out, go into shock, call for help we couldn't give because we were trying to save the ones with better odds. One of them was Corporal Frank Martinez from my company. I'd treated him for minor wounds twice before. Now I had to watch him die because we needed the morphine for someone more likely to survive. "Doc," he called to me, "please, it hurts." "I know," I said. "I'm sorry." I sat with him when I could, held his hand, lied, and told him he'd be okay. He died knowing I was lying, knowing I'd chosen to let him die. The look in his eyes, not anger, just resignation and betrayal. That look has haunted me for 12 years. After he died, I went outside and vomited in the snow. First time I'd broken down since the siege started. Captain Morrison found me there. "You did the right thing," she said. "We couldn't save them all. You saved the ones you could. I let Frank die. You let Frank die so 3 others could live. That's the math. That's what we do." I understood the logic. Didn't make it hurt less. The siege continued. The casualties mounted. We ran out of morphine on December 28th. After that, boys had to endure amputations with just ether, and our ether supply was almost gone, too. Some surgeries were done with nothing, just holding the patient down while the doctor cut. I held Private Tommy Chen while the surgeon amputated his arm. No anesthesia, no morphine, nothing. Just Tommy screaming and 4 of us holding him down and the surgeon working as fast as he could. Tommy passed out from the pain halfway through. Mercy, I guess. He lived. But what kind of life? 19 years old, missing an arm, probably traumatized for life by the experience. We saved him. But at what cost? December 30th, 1944. Day 12 of the siege. Supply drops from the Air Force had brought us some medicine, some food, some hope. But the casualties kept coming, and we were all running on fumes. Days without real sleep, working in sub-zero temperatures, watching boys die despite everything we did. I was treating a sucking chest wound in a foxhole. Private David Johnson from Georgia, good kid, always smiling, when German artillery came in. Close, too close. The concussion knocked me down, threw dirt and snow over both of us. When I recovered, David was worse. The shock had accelerated his bleeding, and he was going into cardiac arrest. I did chest compressions in the snow, tried to bring him back, Worked on him for 10 minutes. He died, and something in me broke. I just sat there, hands on his chest, not moving, couldn't move, couldn't think, couldn't process another death, another failure, another boy I couldn't save. Someone was shaking me, Sergeant Miller from my company. Doc, we got more wounded. Need you. I couldn't move. Doc! I can't, I said. I can't do this anymore. Can't watch them die. Can't make those choices. Can't. He slapped me. Hard. You don't get to quit. Those boys need you. Now move. He was right. I didn't get to quit. Didn't get to break down. Didn't get the luxury of falling apart when people were dying. So I stood up, picked up my medical bag, and went to the next casualty. And the next, and the next. But something had broken, some essential part that had kept me functioning, that had let me maintain clinical detachment, that had allowed me to make impossible choices without completely falling apart. It was gone. And for the rest of the siege, I worked like an automaton, treating wounds by muscle memory, making decisions by rote, existing in a state of numb efficiency that kept me moving but left me hollow inside. On January 9th, Patton's Third Army broke through the German lines and lifted the siege. We'd survived, lost thousands of men, but the 101st had held. We'd won. I felt nothing, just empty. They evacuated the wounded, brought in fresh medical supplies, pulled us off the line for rest. I sat in a warm building with hot food and clean clothes, and all I could think about was the boys we'd left behind, the ones we couldn't save, the ones who died in that frozen basement or that snow-covered foxhole or on that surgical table when we ran out of ether. Frank Martinez, David Johnson, James Walker, Mike Rodriguez, Tommy Sullivan, all the others. Names and faces I'd carry forever. It's 1956 now, 12 years since the bulge. I came home, finished medical school on the GI Bill, became a doctor like my father, work at a hospital in Minneapolis, treating routine cases, living a normal life. But I'm not normal. Not really. Every winter when the first snow falls, I smell it again. Ether and blood and frozen earth and death. I'm back in that church basement, back in those foxholes, back with the boys I couldn't save. The smell is so vivid, so real, that sometimes I have to leave the hospital, go outside, remind myself I'm in Minnesota, not Belgium, that the war ended 12 years ago. My hands shake when I work in the cold. Can't help it. My body remembers what it was like to treat wounds with frozen fingers, to lose boys because the plasma was iced over, to make life or death decisions in sub-zero temperatures while someone bled out in front of me. I'm a good doctor. Everyone says so. Calm under pressure, good hands, excellent diagnostic skills. They don't know that I learned those skills watching boys die, that my calmness is just practiced numbness, that I can work efficiently in emergencies because I learned how to function when functioning was impossible. Sometimes patients thank me for saving their lives. I smile and accept the gratitude, but inside, I'm thinking about all the ones I couldn't save. Frank Martinez dying while I chose someone else. Tommy Chen screaming during an amputation with no anesthesia. James Walker rotting alive from gangrene we couldn't treat. I don't deserve gratitude. I just did my job. And sometimes my job was choosing who lived and who died based on cold calculations of resource allocation and survivability percentages. My father asks me sometimes why I don't talk about the war, why I never tell him what it was like, what I saw, what I did. He's a doctor, too. He'd understand the medical side, the challenges, the impossible situations. But he wouldn't understand the rest. Wouldn't understand what it does to you making those choices, marking boys with black tags and watching them die, holding them down during surgery with no anesthesia, working until you break, then working more because breaking isn't an option. I tried to explain once, Told him about the frostbite cases, the gangrene, the cold that made everything harder. He nodded sympathetically, but didn't really understand. How could he? He works in a clean hospital with unlimited supplies and controlled temperatures. He's never had to choose between two dying boys because he only had one dose of morphine left. The nightmares come less frequently now. Used to be every night. I'd wake up screaming, back in that frozen basement with boys dying faster than I could save them. Now it's maybe once a week. Progress, I suppose. But the smell never goes away. Every winter, every snowfall, every cold day. I smell ether and blood and Belgium, and I'm 23 years old again, working in impossible conditions, losing boys I'd promised to save. Captain Morrison sent me a letter last year. She's a nursing director now, married, has kids. She asked if I ever think about Bastogne, about those weeks in the church basement. I wrote back and told her no. Told her I'd moved on, that the war was behind me. I lied. She probably knew I was lying. She probably lied in her letter, too. You don't move on from something like that. You don't forget the boys who died while you were trying to save them. You don't forget making choices that meant some lived and others died. You don't forget what winter smells like when it's mixed with blood and death and failure. I'm a doctor now. I save lives every day. Work in comfortable conditions with proper equipment and unlimited supplies. Should feel like redemption, like making up for all the ones I lost. It doesn't, because the ones I lost weren't lost because I wasn't good enough or didn't try hard enough. They were lost because war put us in impossible situations with impossible choices. And no amount of saving lives now will bring them back. The Battle of the Bulge ended in January 1945. But for those of us who were there, who worked in that frozen hell, who made those impossible choices, it never really ended. We just learned to function despite it. Learned to smile and go through the motions while carrying the weight of all those we couldn't save. Every winter, when the snow falls and the temperature drops, I'm back there, back in the cold, back with the wounded, back making choices no one should have to make. The smell of ether and snow. That's what I remember most. That particular combination that meant boys were dying and I was running out of ways to save them. 12 years later, I still smell it, and I know I'll smell it for the rest of my life. We never came back from Belgium. Not really. Part of us stayed there in that frozen basement, in those snow-covered foxholes with all the boys we couldn't save. Still there, still trying, still failing, still smelling ether and snow and death forever.